Hello, I'm by the name of Innocent Karekezi, and I'm a student at Southern New Hampshire University, currently pursuing healthcare management with concentrations in communications. In this video recording, we are going to talk about the primary components of electronic health records, along with related benefits and issues. So to start to introduce electron health records, I would say according to healthit.gov, they says that electronic health records are digitalized, real-time, patient-centered records that make information available rapidly and strongly to authorized users. Literally, a computer system that medical practices use instead of paper charts. In addition, uh, electron health records are virtual parts of health IT, and they can actually contain a patient's medical history, diagnosis, medications, treatment plans, immunization dates, allergies, radiology image, and laboratory as test results as well. It can also allow access to evidence-based tools that providers can use to make decisions about patient care. It also automate and streamline, provide framework. That is what electron health records as part of health IT, what it can do. So to continue, let's look on the described components of electron health records that support direct clinic care and explain associated benefits and issues. There are many components that support the electric clinical care, of course, and those are first one is patient demographics. To explain this, let's actually, according to Macadamia Technologies 2011, this is the most important part of medical institutional record, and it's often used for statistical analysis. I mean, patient demographics. It also includes details such as date of birth, gender, birth year, ethnicity of the region, and others, of course. And also some of the benefits that are around patient demography, allowing easily identification of the patient for biological test, understand the patient's culture, and others. Those are the benefits. Meanwhile, some of the drawbacks, or some of the issues that is around with patient demographics, the issues with this part actually includes difficult in locating certain types of information, such as ethnicity, as well as concern about patients' privacy and confidentiality, and they are actually occasionally violated. So the second one is medical histories. This provides information surrounding patients' medical history, such as allergies, surgeries, laboratory tests, and physical examinations and tests as well. So for the benefits around medical histories, I would say that the benefit of medical histories can include the easy with which physicians and specialists may assess the patient's record in the event of accident or emergence, of course. So some information can be exchanged with other doctors to actually help identify patients more accurately and minimize the medical error. Uh, However, some of the drawbacks include breach of privacy and patient confidentiality, as well as being time consuming and actually prawns. So to move forward, let's look on described components of electron health records that actually support administrative processes and explain associated benefits and issues. So to have a belief or to have this understanding, let's firstly have a reference. So according to National Institute of Health 2006, there are components of electron health records that support administrative processes and the associated benefits as issues as well. The first one is registration. So this contain a unique patient identifier that normally consists of numeric numeric and alphanumeric sequence, of course, that is recognized outside the institution in which it serves, and it is not necessarily limited to name, demographics, next of kin, employer information, chief complaint, patient disposition, etc. So looking on the benefits of these components are provisions of timely service to patients, more timely payments, and less paperwork. However, very hard to collect data is an issue, and some information may be normally violated. This is some of the issues. So for the second one is discharge. So this ensures continuity of quality care between patients and the community as well. Moving some of the benefits of discharge is increasing patient satisfaction due to quality treatment offered, of course. So but the issue that is around discharge normally includes time interval errors that happen as a result of emergency issued and inaccuracy of some of the data. So to continue, let's look on the importance of integration and administrative and clinical areas for efficient use of health electron records. So basically, according to Alpha Tolman, 2012, there are some of the importance of integration of administrative and clinic areas for effective use of health electron record or record health, or yes, of course, health electron record. So I would say the first one is enhanced practice management. So to explain this, normally is through using clinical data to make an informed decision in the areas of administrative, such as improving accurate billing and reduction in loss charges. So also there is what we call integration of administrative and clinical areas, facilities, preventive medical and improve healthcare coordination, eliminating waste and allow electron health records to be used more effectively. So the last one, which is the third one, is that this integration also provides reliable data to administrators and medical practitioners, allowing administrator to accurately monitor the organization and physics to treat patients based on the correct information that has been recorded. So thank you for your attentions. This was the primary component of electronic health records, along with related benefits and issues. Thank you so much.